Hi, my name is Dr. Tim Speciale. Thanks for joining us today. This is my good friend Mike, and we're here to talk about low back pain, which many people throughout their lives will experience low back pain. And Mike has a very unique story about pain. He's had it for many, many years. He's had many practitioners trying to help him. I saw him a while ago, and he has had a really traumatic response. So, Mike, could you tell me a little bit about your story? What brought you to see me?
Yeah, I was in a car accident on New Year's Eve in 2011, and I've had lower back pain and hip pain ever since. I've seen many of chiropractors, I've seen physical therapists. Everybody promising that they can get me a little bit better, and I've always gotten just a little bit better, but never to the point where I've actually felt recovered. And then I met you.
And so what happened then, Mike, since you had the prolotherapy?
Since I've had the prolotherapy, my whole life has changed. I'm able to play with my 5-year-old son down on the floor. I can shovel the snow without being in pain. I wake up in the morning and my recovery time is about a minute or two of walking around. And I feel like I've actually got my life back and living a more normal life like I used to.
Now, didn't you tell me your wife was very skeptical about this? And
My wife was so skeptical of this. She's telling me that you're using dextrose, that it's just a placebo. But she lived with me for the last 10 years of my pain, and she said, you know what? Whether it's going to work or not, you might as well try it just to see. And I tried it, and so far, so good.
good, thanks, Mike. So this is a great story. Here is a young guy, and it affected the quality of his life. So he looked fine, but he had a lot of challenges with his low back, his hip. So everything was tight. And when you look at this model here, these ligaments are the ligaments of the sacroiliac joint and your lower back. So he had a lot of sacroiliac challenges. He also had a lot of gluteus problems that went into his hip joint. So we treated both, and with basically prolotherapy to rebuild his back. And it almost seems too good to be true, and but it is the truth. And we've been doing prolotherapy here for going on 30 years. It's very, very successful. There's slow healers, medium healers, fast healers. Mike has been blessed. He's a fairly fast healer. But sometimes people take 3 or 4 visits about 6 weeks apart. There's 3 types of prolotherapy. One is the basic dextrose, which is what I did with Michael, nothing fancy, to cause a mild inflammatory reaction. The second type is called platelet-rich plasma, which he did not need. And the third type are stem cells, which he didn't need either. So the blessing is we do all types. We try basic first, and most people get a great response. So 9 out of 10 people do get better. So anyways, thanks for joining us today, and you have a great day.